Started of house licensing and occupations, our fourth meeting of the year. We have some special new requests I've been asked to make. Please silence your phones or set them to stun, whichever makes you happy, so they don't interrupt the meeting. If you are interested in testifying, there is a sign-up sheet in the back on the lectern. Testimony is within the chair's discretion based on time constraints and information already presented, and no signs are permitted in committee rooms. With that, please call the roll.
Representative Banta. Representative Bratcher.
Here in the room.
Representative Birch. Representative Flannery. Representative.
Annex.
Oh, thank you. Representative Gentry.
Here in the room.
Representative Huff.
Here in the room.
Representative Cook.
Here in the room.
Representative Massey.
Here in the room.
Representative McCoy.
Here.
Representative Meredith. Representative Miller.
Here in the room.
Representative Moser.
I'm here in the room.
Representative Palumbo.
Here in my annex office.
Okay, thank you. Representative Pratt. Representative Santoro.
Here in the room.
Representative Timoney.
Here.
Representative Westrom. Chairman Koenig.
Here in the room. We have a quorum and ready to do business. First bill is House Bill 252. Representative Timoney. Thought I'd go with what I assume will be the least
Morning.
controversial bill on the agenda, and surprisingly enough, it's an alcohol bill. An alcohol bill. An eye-opener bill, yes. With you, you have any guests? I believe you have.
Yes, sir, we do.
All right, well, the floor is yours. Bring those to the table, and when they get up there, please have them introduce themselves. We also, I believe, have Mr. Fitzer on Zoom. Mr. Fitzer, are you with us?
I am. Can you hear me?
Thank you very much. Yes, sir. Thank you.
Thank you.
All right, Representative Timoney.
Thank you, Chairman, and thank you, Committee, for this opportunity to present today. Bill today, House Bill 252. We'll get to the details of it, but first I want to go ahead and let my guests introduce themselves.
Good morning. It's David Stubblefield with Kentucky Eagle in Lexington, Kentucky.
And our remote guest.
Oh, I'm Terry Fitzer. I'm with Reno's Roadhouse. I have operations in Kentucky and Virginia.
Kinley Timoney, State Representative, 45th District. Properly identify myself. This bill, there's two main parts to this, but before we get started, there is a committee sub that we'll need a motion on.
A motion by Representative Cook, second by Representative McCoy. Any questions on the sub? All in favor signify by saying aye. Aye. All opposed? We have the sub before us.
Thank you. The gist of this bill is to lower the server age from 20 to 18. And that's one of the key provisions in this bill. The second key provision of this bill is it does, the difference between the original bill and the committee sub is that it does allow beer wholesalers to employ people under the age of 20 also. That's
Motion on the bill. Second.
that's all I'll say.
We have a motion and a second. We do have somebody who is signed up to speak against, so if you all would give a little bit of your testimony so that we can have Mr. Cole come up afterwards to share his opinion so that everybody knows both sides of the issue.
Sure. Can I give my guests a moment to discuss the importance of
Yes.
the bill to their industries? Thank
Yes.
you. Go ahead.
Well, on behalf of the Restaurant Association and with Rafferty's, the main topics are neighboring states such as Tennessee and Indiana. In Tennessee, the serving age is 18. In Indiana, it's 19. Just a couple of good examples. In Clarksville, Tennessee, we have a restaurant there that currently employs 8 people that live in Kentucky, either in Hopkinsville, Elkton, and those areas, so forth. And in Evansville, Indiana, we have several employees that come from Henderson, Kentucky to drive across and work in our restaurant there in Indiana because they can serve at 19. As with every industry, we're having problems finding people. A lot of our restaurants and other restaurants operate in college towns. This would allow us to attract more, and automatically, as soon as they get out of high school, we call it getting a new crop of people because they're already ready to work and ready to go to school and so forth. So they're going to college, waiting tables. It doesn't necessarily mean they're going to be drinking any kind of alcohol. The current law is 20, so 18 is really an easy starter for, I believe.
Thank you.
So speaking from the beer distributor, malt beverage distributor point of view, we've struggled to get folks employed, and our 7 members have had more than 45 open positions, sometimes as many as 60 positions, mostly entry-level positions that we have struggled to fill. And over the last 2 years, that has actually worsened, and this opportunity to bring 18, 19-year-olds into an entry-level position would be a great help to us. One of the interesting positions that for us here at Kentucky Eagle, in Lexington being associated very closely with the University of Kentucky, they're our home university, we have had numerous opportunities for internships, and to date, we've always had to keep that to grad students because those are the ones over 21. And, that would be a big help to us to bring folks in to allow them to partner with University of Kentucky to bring accounting students in, digital marketing students, that kind of stuff, and give them a real taste of, working in the industry. So it would be a huge help for us.
Mr. Fitzer, I know we had you come talk in the interim with Representative White, who had a similar bill, so we wanted to make sure, since he's not able to be with us, that we were able to include you, and we appreciate your participation. Please give us a few minutes.
I appreciate the ability to address you guys. I would echo my colleagues' comments from Rafferty's. Obviously, it would help us, and it would expand the pool of people that we can draw from. As I mentioned when I testified earlier, I have an operation in Virginia which allows 18-year-old servers. We've been in operation there for 20 years, never had an issue, never had a problem. It just opens the pool up and allows us to employ more people, especially college freshmen. And we're in Moorhead, our operation there is a college town. Freshmen can't work certain positions in the restaurant, which really shrinks that pool. But I think most importantly, we have a girl currently working for us. She's an 18-year-old single mother, sharp girl, working hard. We've got her in a management position, entry stage, obviously. She's training people how to serve. She's training people how to handle their business at the tables, yet she can't even demonstrate for them how to do it live because she's not old enough. But, she's a hard worker, sharp girl. The issues of them touching alcohol really isn't going to be an issue. They're exposed to it everywhere they turn. And it's up to us as management to control that, to make sure it doesn't happen for an 18-year-old, a 19-year-old, or a 20-year-old. Thank you.
Thank you. Any questions for this group? Seeing none, we appreciate it. If one of you would hop up so we can give us space for Mr. Cole to come down. Mr. Cole, welcome back to the committee. Come on down. Introduce yourself for the record, and if you keep your testimony to a couple minutes or a little bit more, I'd appreciate that.
Thank you.
Yes, sir. I think so.
There you go. Yeah, there it is. Thank you. Appreciate the chance to being heard. My name is Gene Cole. I'm with the Kentucky League on Alcohol, Gambling Problems, and Substance Use Disorders, Kentucky Ethics League. with this bill, we see the problem of it's more of a general issue. Like in the military, everybody's heard it. I can serve my country at 18, so why can't I drink? I can serve alcohol at 18, so why can't I drink? Issue. I appreciate and understand the issue with the employment pool, trying to get enough people in. Don't know what the full answer is. Maybe there's some other avenues that could be looked at to attract more people. And when a person's going to college, they should be going to college, not to have to work to go to college. But they should be able to go and concentrate on their studies instead of having to worry about going to work. And that's pretty much all we've got to say about it.
I appreciate that, Mr. Cole.
Thank you.
Any questions for Mr. Cole? All right.
Motion
Thank you.
on the bill.
Well, we have a motion and a second before us. Seeing no further questions or comments, please call the roll.
Representative Banta.
Yes.
Representative Bratcher.
Yes.
Representative Birch. Representative Flannery.
Yes.
Thank you. Representative Gentry.
Yes.
Representative Huff.
Yes.
Representative Cook.
Yes.
Representative Massey.
Yes.
Representative McCoy.
Yes.
Representative Meredith. Representative Miller.
Yes, ma'am.
Representative Moser.
Yes.
Representative Palumbo.
Yes.
Representative Pratt. Representative Santoro.
Yes.
Representative Timoney.
Yes.
Representative Westrom. Chairman Koenig.
Yes. Motion passes. It seems to pass on the House floor.
Thank you, committee. Thank you, Mr. Chairman. I do want to really reiterate the fact that Richard White carried this through the interim, and he put a lot of legwork in with this. And obviously, he's not here with us to do this, but he needs to he gets all the credit for this. Thank you.
Appreciate that. Very good. All right. Next up, House Bill 340. Representative Dixon, who was hiding behind the post, was worried if my sponsor was here or not. Come on down, have a seat. Just for the record, going forward, we always need guests to introduce themselves, but I don't think members need to introduce themselves in this committee, so that'll kind of be the standard going forward. I think we all know who each other are. But if you go ahead, Representative Dixon, and have your guests introduce themselves.
Absolutely. Thank you, Mr. Chairman, committee members. Thank you for the opportunity to present House Bill 340 before your committee today. Representative Jonathan Dixon, I'll let my guests introduce themselves.
Julie Campbell, the Kentucky Board of Cosmetology Board Administrator. Thank you, Mr. Chairman and members of the committee.
Good morning, everyone. My name is Christopher Hunt. I am General Counsel for the Board of Cosmetology.
Mr. Chairman, we do have a committee sub.
We have a motion by Representative Cook, second by Representative Timoney. Any questions about the sub? Hearing none. All in favor signify by saying aye. Aye. All opposed? All right, we have the sub before us.
All right. Thank you, Mr. Chairman. House Bill 340 addresses an important issue that exists in our Commonwealth as it pertains to patient safety and overall health of the patient when receiving medical aesthetics. Medical aesthetics is a fastest-growing industry. Medical aesthetics is a fast-growing area in personal care sector as more individuals are turning to preventative cosmetic care rather than corrective surgery. House Bill Committee Sub that is before you simply adds dentist and to the list of licensees and some corrective language. We also have heard from the optometrists regarding this bill, and we have assured them that we will continue to work with them as this bill moves forward. I would like to allow my guests to give their testimony in a more in-depth of the impacts of House Bill 340.
Good morning. Thank you for allowing me to be here, and thank you, Representative Dixon, for sponsoring our legislation today. The legislation in front of you is very important to the protection of the Commonwealth from a variety of perspectives. I know that there is opposition in the room about the Cosmetology Board's sponsorship of this legislation, but please know the Kentucky Board of Cosmetology has been in contact with administrative staff from the Board of Medical Licensure and the Board of Nursing in regard to this bill for more than 3 years. And the purpose behind our sponsorship is because medical licensure and nursing licensure has no facility oversight or authority, yet the Board of Cosmetology does, and more importantly, in a full inspection staff able to look at the safety practices in those facilities. We are not trying to step on any toes. All medical personnel will be overseen and regulated by their respective boards and not the Board of Cosmetology. It is just the facilities that cosmetology will watch out for. All other issues will be referred to the board's respective sections. At this time, licensees in cosmetology can perform certain services. They do require medical oversight, and there is a lot of areas that they are employed: dermatology offices, plastic surgery offices, as well as med spas. And they are required to work in a licensed facility. So a med spa operating today that has a licensed cosmetologist or esthetician on staff is still required to have at least a salon license managed by that individual for them to be in compliance with the law. There is no current statutory oversight or authority for training and specifics for injectables, invasive procedures offered in a med spa, lasers, etc. Several years ago, we received a complaint on an individual at the Board of Cosmetology who was performing a number of these services. I reached out to both the medical board and the nurses board, thinking incorrectly that they would be able to look at this and say, oh, that's practicing medicine, or, yeah, that's outside of their scope. We can help you with that. Unfortunately, as the law sits today, no boards have any authority for oversight on this area or are able to create scope of practice definitions in this sector. So the risk of infection is significant, as well as disfigurement and even death. So we've worked really hard to see that this is written to improve the protection of the Commonwealth, and that each board retains its autonomy and ability to regulate properly. Thank you.
Thank you. I don't have any additional comments. I'm basically here for moral support, and if there's any questions, I need to.
Very good. I have a motion from Representative Santoro, second from Representative Timoney. We're not ready to vote on it quite yet. We have a question from Representative Westrom.
Can you tell me how you have defined scope of practice?
I have not defined scope of practice for the medical practitioners or the nursing practitioners, only for the cosmetology and aesthetics practitioners.
And what does that say?
It says that certain services at elevated levels that go below a cosmetic level of surface correction are required to be overseen by different medical personnel, and that is all set forth in regulation at this time.
I just have to say that I've had a vast number of people from the medical community that have responded to this legislation, very, very concerned. We don't know what emergencies have ever occurred in any salons that do cosmetic restoration. I don't know if that's ever reported. Is it ever reported when there's an infection? Or?
Yes, ma'am. In fact, I testified on behalf of the medical board in a hearing to revoke a doctor's license because he was letting his unlicensed wife perform injectables, Botox, etc., and an individual came down with severe infections in her face, and that same individual then turned around and used his authority to write a prescription for an antihistamine and an antibiotic for a sinus infection, not the actual underlying infection, and that the hearing officer has currently upheld the medical board's revocation of that license.
But a cosmetologist can do Botox, is that correct?
No, ma'am.
They cannot? Okay.
Not without direct supervision by a physician or someone defined in scope of practice by the medical or nurses board as being able to supervise that.
So that means they have to be on site
Yes,
with
ma'am.
the physician.
Yes, ma'am.
Thank you.
Representative Moser.
Thank you, Mr. Chair. Thank you for your testimony. I don't disagree that this is needed. There are horror stories about cosmetology, med spas, and a lack of oversight. So I don't disagree that this is needed. I just, I had a concern about the medical oversight, and I think that that's been addressed, but it's not in statute. You said that it's in regs.
So the regulations defining scope of practice for estheticians is a regulation at this time. As far as levels of chemical peels that they are allowed to perform, the training required to do so, different types of microdermabrasions, etc. And it is very clear that it is prohibited practice for them to perform these services without proper oversight.
Okay, but it's not in statute. It's not in this legislation that oversight is required.
No, ma'am, I do not believe it's stated that way.
Yeah, I mean, that would give me comfort knowing that that folks who are trained estheticians and medical estheticians, I understand, have a different level of training. It's nowhere near the 12 years that it takes to become a dermatologist, and so I mean, I have concerns about that. Also, a lot of the terminology that is used in this bill is either obsolete or really needs to be updated. Collagen's no longer used. I mean, that would be a neuromodulator. There are, the collagen injections. I just feel like if we're going to put this in the bill, that we should use the correct medical terminology.
Okay.
And so, I think that there's some cleanup that could happen with that. And I'm not sure what non-superficial means in a lot of these procedures, because the way I see a lot of these, they are invasive. So it's not non-superficial.
So when we say that, we define aesthetics and cosmetology practice nationally is defined as there is no ability to puncture or pierce below the stratium corneum layer of the skin. They are not allowed to go lower, deeper in there without medical supervision than just the surface epidural layer.
Okay. Okay. All right. Thank you.
Representative Gentry.
Thank you, Mr. Chair. Representative Dixon, first of all, he came to my office yesterday and talked to me a little bit about the intent of the bill, and so I appreciate that. And we had talked about not hearing a whole lot of opposition, and I hadn't heard anything as of that moment. Of course, after that, we went to the floor, and a few emails came in, so I forwarded them to Representative Dixon. And I guess my question is, and probably hadn't had any chance to address those at all, is there any plan to address the concerns of the emails that I forwarded? And I don't know if you've even seen them yet, but there are some people in the professional industry that have some issues with the bill, and I didn't know if you wanted to elaborate on that, if you've seen those emails. If you have not, do you have any plans of addressing those issues at all?
Yeah, I appreciate that, Representative. Yes, I have seen those emails, and I think that we're open to working this as the process moves along. I haven't actually spoke to some of those individuals that are, those emails are basing from. So I think that we're trying to address everybody's concerns as we move along and work with everybody in the in this bill as we continue it through the process.
Thank you.
And you filed this bill, I believe, a month ago?
Correct. This was, and it should be noted, this was heard in the interim. You guys heard this in the interim in your committee. I did file this bill over a month ago. It's been sitting there, and up until the past 2 days,
Okay.
But up until the last, we haven't heard any opposition until the last 2 days that this bill has been pulled to committee. So,
Oh my goodness.
Nothing to see here.
Yeah, excitement.
Well, we'll need a budget amendment to fix that. Representative Westrom has another question.
Absolutely. Please be patient with me. I've been here 24 years, and the Board of Cosmetology for the first 17 years, there were women with blue hair that were the head of that organization. Seriously. And they were related to a legislator. So, so it was really, it's very difficult to look at this without thinking there needs to be possibly a different board, a medical board, perhaps dermatology, that would be have oversight of this portion of cosmetology, since there are injectables being used. Has that ever been considered? And not to diminish how important you are. I mean, you're making the world more beautiful, but I really would feel much better with a supervision of a more highly degreed board.
And to address that, we did work with staff from both of the medical board and the nurses board in the discussions on this. And at this time, that is all we're trying to do, is create a pathway that those boards also can create proper regulatory environments for oversight and disciplinary action, et cetera, for individuals who are practicing this. It's the wild, wild west out there. And at this time, just anybody can pick up a vial of Botox and start injecting with or without any supervision if they're not licensed by one of these agencies, and do what they want, have a home Botox party. We're just trying to tighten this up. It's certainly not recommended. We're just trying to tighten this up and make certain that anybody touching a patient or a client is accountable to a board with the proper authority. We are happy to allow the Board of Medicine of medical licensure to set the parameters for supervision, medical director, etc. We don't want to play in that sandbox. We have very defined our regulation of oversight to allow for the nurses board to set up what that supervision looks like from a nursing perspective, what level of licensure they are required to have to supervise. But right now, the nurses board and the medical board don't have the authority to set up that regulatory scheme because there is nothing in statute that exists to create that pathway. So we tried to model this when we worked with that staff, similarly to the pain management clinics, for being able to define roles and create a pathway for the different boards to create regulatory standards.
Any further questions? Representative Mosier.
Thank you, Mr. Chair.
Absolutely.
I'm just looking through the committee sub. Is there a list of the members on the board that you're proposing, the cosmetology board? Sometimes when we
Sure.
write legislation, we identify the members.
So the members of the cosmetology board are Bridget Teal from Paul Mitchell School.
No. Titles, I mean, do we have a medical director? Do we?
No, we have 2 salon owners, 2 members involved with education in the cosmetology industry, and a citizen at large.
Okay. Maybe that's something that you look at, to really identify who the oversight is. Who is this board?
All of our infection control standards are reviewed by CHFS and individuals at that level for safety, and that's really what the cosmetology board is looking to do. Just be able to go in and make certain that individuals are properly licensed who are touching clients, and that those individuals who are not are brought to task in some way or another, or the individual allowing that is.
I still think that it would be helpful to have some medical oversight on the board. So.
All right, we have 2 people signed up to speak against, so let's give them the opportunity to come on down here. Alana Level, did I say that right? Level. and Tanya McCoy. Tanya, were you the one that texted me last night?
Yes.
Okay, and emailed me with a different last name? Just want to make sure I got everybody.
Well, it's a little hard to pronounce.
It is.
Zenyaiko, so I thought I'd do you a favor and just go with my
I appreciate that.
hyphenated name from Kentucky, McCoy.
I couldn't even get level right, so.
That's okay.
All right, if you all would introduce yourselves for the record, and the floor is yours.
I'm going to read off script because I get nervous.
All right.
All right. Chairman Koenig, Chairman Cook, and all committee representatives and bill sponsors. For the record, my name is Alana Level. I'm a nurse practitioner and medical director of a medical aesthetics practice in Danville. Today, I'm speaking in opposition of Bill 340. Today, I'll replace the term med spa with medical aesthetics practice, as the term med spa is lay speech. It does not accurately describe the amount of evidence-based medical decision-making and critical thinking involved in a well-rounded, highly respected practice that is priority in excellent patient care. I've been a nurse practitioner since 2014, and I don't speak publicly very often, if you can tell. I specialize in emergency medicine and secondary education. In addition, I've fervently trained and practiced in aesthetics for over 5 years. I'm considered a key opinion leader, an instructor to fellow licensed medical professionals, and a director and founding board member of the Kentucky Association of Medical Aesthetic Providers. I am passionate about the care not only of my patients, but about patients in the state and nationwide. If you're unfamiliar with the term medical aesthetics practice, I'll give you a little bit of a brief description. As practicing clinicians, we provide consultation, assessments, diagnoses, planning, implementation, and follow-up to medical interventions for the purpose of prevention and treatment of the aging body. This is considered an elective outpatient medical specialty, and though medical aesthetics has not been as common as family practice or women's health, it is still held to the same regulations, clinical operation standards, and requirements through the licensing board in which the medical provider is licensed. Due to the infancy of our specialty until last year, an established professional organization did not exist. And if you're familiar, most medical professions and specialties have a professional organization which help guide scope of practice. The gap in this specialty support had been palpable in the state for years, and which is probably what ignited the spark of this bill. But that palpable lack of support is what ignited the spark of KMAP in 2021. That's the Kentucky Association of Medical Aesthetic Providers. It's the first nonprofit professional organization in the state to offer standards of care, protocols for procedures and emergency events, which can and do occasionally happen, as well as open communication and collaboration between licensed medical professionals and their certifying boards. This organization boasts a clinical faculty and board that spans multiple professions and over 100 years of combined medical aesthetic experience. KMAP aims to serve the medical aesthetics community much like probably organizations you're familiar with, the Kentucky Coalition of Nurse Practitioners and Nurse Midwives, the Kentucky Medical Association, and the Kentucky Association of Nurse Anesthetists. During a recent KMAP meeting, House Bill 340 was brought to our attention, and we were concerned about a few points. First, many medical aesthetic practice ownerships have been established by non-licensed personnel as a personal investment or interest. It's common practice in other specialties as well, across medicine as well. Many clinics are found on the financial backing of someone who felt the need for that type of care in their area, regardless of their credentials. If House Bill 340 were to pass, this would inhibit the growth of the medical care that we offer. I personally was financially backed by a dentist in Danville who had an interest in aesthetics. Since its inception of our clinic, we have been very successful in leading a medical decision. I've been very successful in leading the medical decision making and following the nursing board's regulations to a T. There's a vast difference between ownership and medical direction. Secondly, across all of medicine, not only medical aesthetics, licensed clinicians use unlicensed professionals to aid in the operation of clinical care when the licensed clinician is on site directly supervising. For example, in family practice, if you were to show up to your family practice office with a burn on your hand, likely your prescribing provider would delegate to an unlicensed professional or a medical assistant to apply a prescribed burn cream, dress your wound, and then move on to the next patient to be seen. In medical aesthetics, this practice is also applied. For example, medical assistants in my practice apply topical numbing cream, they clean and prep the skin prior to me treating it, assist during procedures, and complete other miscellaneous orders requested to aid in the treatment under my direct supervision. Speaking to my license and board regulation, this has been addressed by the Kentucky Board of Nursing and has been approved safe at the clinician's discretion. I sent an email yesterday with the KRS statutes and the opinion statements by the board that support this. Physicians and physicians' assistants also operate similarly under the KBML guidance. Under House Bill 340, the above protocol would cease. Medical assistants would only perform administrative tasks, not clinical assistants. This bill negates what has already been deemed safe and appropriate by the Board of Nursing and other licensure boards via the aforementioned KRS statutes and opinion statements. Thirdly and lastly, I'll try to be brief, the bill proposes all medical aesthetic practices register and receive licensure with the Board of Cosmetology. Cosmetologists and estheticians are licensed by their board. Therefore, they are unable to independently purchase, prescribe, and administer the prescriptive things that we use, such as botulinum toxins, Botox, hyaluronic acids, fillers, prescriptive topicals, or dermal stimulators, as only licensed medical professionals may do so under their scope of practice. Conversely, a licensed medical professional like myself cannot walk into a cosmetology supply store and purchase regulated cosmetology supplies. I don't wish to, and I wouldn't even know how to begin to apply those things properly, as it's not within my scope of practice. Requiring medical aesthetic practices to register with the cosmetology board would serve no improvement in our patients' outcomes, safety, or care. It would simply provide another financial burden and time hoop to jump through that would take away from the resources that are better served to improve our practice in our medical realm. As licensed medical providers, we serve as patient advocates. It would be an irresponsible act to place the Board of Cosmetology as the designated regulatory board for a medical practice. However, imposing additional regulations to our practice is not commonplace, even in other specialty clinics, such as dermatology or plastic surgery or family practice. It would be an excess to the practicing clinicians who are already regulated by their certifying boards. In closing, I would like to thank you for your service as elected officials. We know your job is hard, and you serve the state of Kentucky well. I appreciate this opportunity to speak on behalf of my profession and medical specialty. I also would like to thank my many colleagues, including estheticians, nurses, physicians, dentists, nurse practitioners, physician's assistants, and nurse anesthetists throughout the state who have entrusted me to be their voice in opposition of House Bill 340 today. I welcome any further dialogue you have.
Thank you. If I may, we have about 15 minutes. Representative Pratt has to chair a meeting that I have to be in also. So if you could keep your comments, tell us all we need to know and nothing more, if you would.
Okay. So, Chairman Koenig and Vice Chairman Cook and
Your mic is on.
Oh, there it is.
Thank
okay.
you.
And committee members, I appreciate your time and the opportunity to speak before this committee. I'm a licensed esthetician under the Kentucky State Board of Cosmetology. I've been practicing in this field for over 14 years. Over my career, I have worked in a salon and day spa, a medical aesthetics practice, as well as a plastic surgery practice. The majority of the time has been working in the medical aesthetics field under the direction of a physician. A simple description of an esthetician can be described as a skin care specialist, making us a perfect fit for the medical aesthetics practices. We are trained in the anatomy, sanitation, and universal precautions regarding bloodborne pathogens. We are trained to analyze the skin and apply modalities to optimize skin health in a safe manner. In the medical aesthetics environment, I was trained extensively on all the procedures I was instructed to do by a doctor. Modalities for optimal results and safety. Recently, the cosmetology board has actually reduced the amount of hours that our specialty, the estheticians, actually is required to even practice on our own license. I would feel that it is more prudent to actually, for the cosmetology board, to look at their own standards of education to increase the esthetician's ability to continue what we do. The difference between what I can do on my license alone, we do a lot of the same procedures. It's just getting the the particular, like if I did a chemical peel on my own, there's a certain depth that I can actually even purchase from any suppliers on my own license. And I do that in application. To purchase the deeper, more medical treatments, it has to be purchased in a medical setting. And then under their direction, I can apply it in a safe manner. It is the same manner of application. It's just understanding under the direction of a physician how deep that goes. That's patient selection, education. I do think it's more important for the cosmetology board to elevate our education. Should there be a bridge program for what is a esthetician that can practice on their own versus a bridge program of extensive education for those of us working in a medical setting versus putting legislation on an already governed body and specialty?
Thank you for your testimony. Representative Miller has a question.
There are 19 services listed in this bill. Of those, how many should only be done in a clinic, a medical clinic like yours?
How many should only be done?
Right.
Anything
Or
that requires
is this permanent makeup?
Sure.
Does that only be done in your clinic, or is it okay
Anything
to be done in
that
a
requires
boutique or
a
whatever?
prescriptive authority. So if you have to obtain a medical or nursing license and have a prescriptive authority to do so, it should be done under direct medical supervision. So Botox, my license has to be registered with that company. I personally have to order it, and it's a prescription that is given and dosed out appropriately to the patient. Anything that is obtained via prescriptive authority.
As I actually cannot get through those aspects, I cannot purchase Botox through these companies. I cannot register with Allergan. I cannot register with Galderma to purchase these products to have in a facility where I work under my license alone.
Many of those energy devices that estheticians are often delegated to use, so lasers and such, you still have to have a medical license, and the person that is purchasing said device must know how to operate and mitigate complications as well. So when we are delegating to an esthetician or an unlicensed professional, we are taking that assumption upon our own license and our own knowledge and our own education, and we're responsible for that.
One follow-up.
Sure.
There's a permanent makeup type clinic, I can't recall what their name is, but in my district, and at least on their website, they don't indicate that they've got anybody medically related on staff.
So a lot of this is very, very gray, and I 100%, I don't think we don't disagree. We do not disagree that this field needs some structure.
Okay.
100%. This field needs some structure. And when things grow fast and rapid and garner revenue, lots of people want to get involved, which is great. We're very passionate about it. But that insert the organization KMAP, we felt that need. We sat and we have invested our own time and money. We've developed a nonprofit status. We're going back through everything, trying to help make those standardized recommendations. Most medicine, you are regulated by what you can do as far as statutes by the law, but when you turn into best practice standards and what appropriate protocols are, those aren't really regulated by the law. Those are regulated by your professional organizations that help set those standards for practice. So that's the gap that we hope to fill. We started about last May, so we're almost a year into development. We just have to get our feet under us. We're getting there, and we're doing it fast.
So in a few year or two, you might be there.
I'm thinking about 6 months. We have 12 amazing faculty that are working every ounce that they can. In 12 months, we'll have this touch point ready to go. We have most standards in place and all the research in place already.
Thank you, Mr. Chairman.
Thank you. I have a question, Mrs. Level. You were saying that, these things need to be done under supervision of a medical professional, that you have to, there's only certain things you can purchase and stuff. Isn't that pretty much what the previous testimony said?
So the previous testimony, My issue is with a lot of the statements in the bill. The previous testimony, I agree with the heart of the previous testimony. We need some type of guidance. But the heart of the bill says that I can't use medical assistance. Why can't I use medical assistance? I use them in family practice. I use them in the emergency department. Why can't I use medical assistance? Why can't someone that is non-medical own a med spa? There are a lot of things as far as regulating a medical practice. The cosmetology board wants to come in and regulate the brick and mortar and the cleaning practices. Medical cleaning practices are completely different and held to a different standard than the cosmetology board on some aspects.
Okay. And we have about 5 minutes before we need to vote. What I heard in the previous testimony, and I should probably just have Ms. Campbell come up and explain it, but what I heard in the previous testimony was that you can use assistance to a certain degree. And what I just heard you say is that you can't use assistance.
I have the bill back at my seat, but
Okay.
the bill explicitly says that you cannot, if you're not part of the aforementioned license, so physician, nurse practitioner, it says nurse, physician assistant, or licensed esthetician, you may not provide any clinical care outside of administrative duties.
Okay. Ms. Campbell, would you like to come down and respond to that and or anything else?
Thank you, Mr. Chair. Thank you, Mr. Chairman. We were told by the medical board that a medical assistant is not allowed to be delegated to perform prescriptive treatment whatsoever. But we would certainly leave that to the medical board or the nurses board, whoever oversees the licensing scheme of that individual, to set those standards insofar as that. But delegation of injections and things of that nature without proper oversight, the whole situation is there isn't a pathway to create that standard at this time. There is no authority for the medical board to set those levels of care or definitions of directors or et cetera at this juncture, nor for the nurses. And to be frank, a nurse's advisory opinion also says at this juncture, completely contrary to cosmetology law, that a nurse can perform perms, brow tinting, color, etc. Ms. Level has stated that she would not even want to go into a supply house, but yet the nurses board has given an advisory opinion saying that they can do any manner of practice in cosmetology already, which advisory opinions don't, while they can speak to law, clearly don't always follow all the law.
Do you have a quick thing you wanted to say?
My opposition also comes from, basically with the cosmetology board being the regulatory entity in this. I do feel like where the aesthetics practice is in its infancy in the state of Kentucky the bill only passed 15 years ago, and the majority of the board members, as she spoke to, were salon owners and cosmetologists. I don't feel like estheticians are represented appropriately on that board for the understanding of what we do in a medical setting.
And we don't disagree as a board that there needs to be a bridge individual between a basic esthetician and a medical environment. That's just not something we've been able to tackle at this time to date to create that. Several states have come forward with advanced practice aesthetics licenses that build on a basic license, and that is something that the board has discussed and is looking into. It just has not. Creating a whole new licensing scheme is, as you know, ponderous.
Sounds like an additional topic for the interim.
Yes, sir.
So, any further questions? Seeing none, please call the roll.
Representative Banta.
May I speak on the bill?
Yes.
Just very quickly, I think that I've never been so confused. So, and I need you guys to work this out because I'm going to be in desperate need of these services, lots of them. So I'm going to be a yes today. I want to get it off the floor, but I think that we need to work together and get some stuff going. Okay? Thanks.
Absolutely.
Representative Bratcher.
Yes. Yes.
Representative Birch.
Please do, but use your microphone. That was a pass.
Pass.
Yes.
Representative Flannery.
Yes.
Thank you. Representative Gentry.
Explain my vote.
Yes, sir.
I'm going to be a yes today. I think the Representative Dixon has offered his intentions of addressing issues that are out there, and we'll move it forward now. But I do think there's some work that needs to be done. So I'm a yes now and reserve my opportunity to change later.
Representative Huff.
Yes.
Representative Cook.
Yes.
Representative Massey. Yes. Representative McCoy.
Yes.
Representative Meredith. Yes, ma'am. Representative Miller.
Explain my vote.
Sir.
I'm voting yes today. I don't think we're ready for big changes in the bill. It doesn't sound like, but I'd love to hear in the interim, and since aesthetics are like tattoo parlors, I mean, perhaps you could invite a tattoo parlor industry representative in the interims.
Well, Representative.
We don't
No.
I don't think we regulate them at all.
We're going to talk about that later.
Representative Moser.
Explain my vote.
Yes.
We don't even touch that. I'm going to be a yes today just to keep working on this, but I think this needs a lot of work. I do not like the fact that the Kentucky Board of Cosmetology is overseeing medical estheticians, physicians, nurse practitioners. I know it's the facility. I understand the separation of licensure, but I still think that we need to add some members to this board or create a different board, something else that oversees this facility. Thank you.
Representative Palumbo.
May I explain my vote, please?
Yes, ma'am.
I will pass until some issues get worked out with this legislation. Thank you.
Representative Pratt.
Yes.
Representative Santoro.
Yes.
Representative Timoney.
Explain my vote briefly.
Yes, briefly.
I'm a yes vote today, but it definitely seems like there's some work to do with this. And just from the sense I'm getting, I think we have all the elements of compromise here. Yes. We're just like a conversation or two short of it. So I'm a yes today to get it out. Let's get it done.
Representative Westrom.
I'm going to vote no today. I think this bill needs a lot more work, and I'm quite horrified to think what would happen if it did come to the floor for a vote. It would likely pass because of the numbers. But I think for public safety, I think there needs to be a lot more in-depth research. I think you can do something. I don't know if it'll happen this session. And I wish you will. I'm so glad this is being done. It's overdue. Thank you.
Chairman Koenig.
Yes. Motion passes. Same should pass on the House floor. Thank you all for your participation. Representative Pratt, would you like to make a vote on 252? There we go. Thank you. Having come to the end of the agenda, we're going to stand adjourned. Be prepared for longer meetings going forward on more interesting topics. I'm sorry, more controversial topics.